This is the old one, right, Vijay? Edited one. This one is the
No.
edited one.
Yes, yes. Right, right. This is the final one.
Very, this is the final one. Okay. So very good evening, everyone. Today we will learn from Vijaya ma'am the biochemical aspects of medical nutrition therapy. So who is Vijaya ma'am? Most of you know those who have did our classes or the master classes of cardio and obesity. So she is 12 years experience in the field of academia and research. She is MSc in biotechnology as well as biochemistry from the Calcutta School of Tropical Medicine. She is the state rank holder and distinction in the master degree, silver medal awarded by the government, nominated for the Department of Science and Technology. So we welcome you, Vijaya ma'am, for the session. And today we are trying to bridge the gap between the theory and the practical. Most of you belong from different colleges or doing your masters or maybe doing your graduations, and you are coming to the field of nutrition as a dietitian, clinical dietitian. So to practice as a dietitian, I find one of our student. She is not student. I don't know. She is from basically from Maharashtra. Yesterday I got a message in the messenger. Previously I also got a message that what should be the diet for thyroid, what should be the restriction for PCOD. And yesterday she asked that, sir, can you suggest a renal diet? So it is not her mistake. And in one line, I requested her that please call me in my mobile so that I can give you the details about that. But it is not possible to answer. Even most of you are giving interviews for different section. Previously, there was an interview for the government sector, that is onco nutrition for Chittaranjan Cancer Hospital. So they used to give some case studies. So the case studies will be based on some parameters. The patient is an onco patient, patient has undergone chemo, patient is having diarrhea, the patient is also having diabetes. So which of the aspects will be given priority, or how to do? So if you know the biochemistry behind that, you can easily formulate the diet. Why happening? What is insulin resistance? Why PCOD is similar to diabetes? In this way, I will not take much of our time of the class. So in this way, if you understand the reason behind that, you can easily find out the solution. So our entire 6-month course of medical nutrition therapy will have the aspects of biochemistry. Our senior faculties from different hospitals will take the medical nutrition therapy part, and Vijaya ma'am will take the biochemical parts. Suppose LFT, what is the significance of lipid profile, what is the significance of lipid profile, or liver function test, or renal function test. So these all will be taken by ma'am. Apart from that, there are many reactions. If I ask some of you some of the pathways of gluconeogenesis or glycogenolysis, so even along with you, I will also not able to answer all the things. So today I am also going to learn. So thank you, Vijaya, once again, and let's start the class. Everybody can switch off the video except me and Vijaya ma'am. Whenever required, you will switch on the video and ask the question. We'll take the question at the end, but there are in between some questions ma'am will ask. You have to raise your hand. I will tell your name and you have to give the answer. Okay. There is a knowledge hunt type of thing. So we will ask you the question. Thank you.
Okay, a very good evening to all, and sincere apologies for being delayed. So like you all know that today our topic of discussion is regarding theory versus practice. So we will be learning that what is the application of the theory in your real life situation. So most of you are already somehow related to Cognized Nutrition. Those who are new on this platform, I just wanted to inform you that this is an organization which is highly motivated to deliver knowledge and build up skills. It also provides opportunities and guidance at every part of your career. So the foremost concept of us is to deliver knowledge. Now, when we talk about knowledge, there are multiple aspects which come into our mind. Like many a times it happens that there are things which we know, but we don't understand. And there are things which we know the application, but behind which the concept is not very clear to us. So we can categorize knowledge in 4 distinct aspects. The first one here is the known knowns, which means something which you already know and you exactly know that how it is applied, what to do with it. The second one is known unknowns, where you know the concept, but then you don't know how it is to be applied. The third one is unknown knowns, where you know the application, but then you don't know the concept. And the last one is unknown unknowns, which means neither you know the theory, so there is no point of application or no point of understanding, right? So I will just give you a few examples to understand that what exactly I mean by this. So here I have few set of questions which will help you to check your knowledge, right? So let us begin then. The first one which I have here is very simple, and that is, what is insulin? Anyone can volunteer, anyone can answer. What is insulin? A simple one.
Yes, Arunima Barik. First, she raised hand. Arunima, you can switch on your video, audio, and tell
Okay,
what
sir.
is insulin.
Good evening, ma'am.
Yeah.
So, insulin is a good evening, ma'am, and sir as well. So, insulin is a hormone. It's a protein hormone that actually helps us alleviating our excess blood sugar after we can say postprandially or after we are having our meal.
Okay, wonderful. So insulin
Any
is
better
basically
answer?
a
It is
hormone.
correct. It is correct.
Okay, right.
Debashruti Roy, I will take one answer more. If you can give it, or Otonu Langal, Otonu, if you can answer it.
Insulin is a peptide hormone released from the pancreas, beta cell of pancreas, which help to regulate our blood sugar level.
Okay. Okay. Is there any other function that you know of insulin other than blood sugar regulation?
Ma'am, may
Ma'am,
I answer this?
Yes.
Actually, insulin helps to carry the
Okay, I
glucose
guess
into our
people are.
blood. Into our cells. Yes, ma'am. Good evening.
Okay, but that is again
Insulin.
related to blood glucose level, right? I'm asking that
ma'am, I
other
want
than
to answer
glucose
if you
regulation.
permit me. Ma'am, I want to answer you.
Okay.
Actually, I thought you were asking
Yes.
in single line answer. That's why I answered little, but I didn't understand you were asking for elaborate. So it
Any other
helps in
function?
lipogenesis. It helps in
Good.
lipogenesis.
Okay. Can you please explain how?
Actually, ma'am, it carries glucose into the cell because it's a carrier, and the thing is that lipid is made up of glucose and lipid is made up of fatty acid and glycerol. Actually, that glycerol part comes from glucose itself. Glucose plus alcohol makes it glycerol. So
Okay.
basically, it's the insulin one which helps to carry the glucose, and in that way, it's a further different and complex type of biochemistry that finally, so in that way it is related to lipogenesis. So if insulin is
Okay.
not there, that thing wouldn't be carried into the adipocyte tissue, and finally that lipogenesis part will not be there.
Okay, okay, very good, great. Which means that insulin will help in lipogenesis. But again, you are talking about glucose. You are telling me that how it will help the glucose to enter into cell, and then how the glucose will build up the lipid, correct? I asked, is there any other function of insulin other than glucose regulation? That is glucose transportation, any other function? Do you understand?
Who is the name of the insulin comes with diabetes or the glucose, any other function of insulin in the body? What insulin does in the body? Somebody can, if you can volunteer. And also my additional question I want to add, when we check our serum insulin level, sometimes we ask some patients to go for serum insulin level, seeing the some clinical symptoms. And one of my pediatrician seeing some symptoms in the face or neck, he used to ask the patient to check for the serum insulin level, then for the diet, lifestyle modification. This is the second question. So if you can answer.
Okay. I will just give you a small hint if you can use that hint. Have you ever noticed that in case of some of the diabetic patients, right, who don't have insulin, they show weight loss or they show fat loss from their body. They have lean body. Can you just tell me what type of diabetic patients look like that who don't have much of fat in their body?
Ravi,
Type 1 diabetes.
Type 1 diabetes, very good. Remember, insulin performs two major functions. One is, of course, to uptake glucose that you all know, that is your known, right? That is your known fat. The other major function of insulin is that it will stop the process of lipolysis, right? It stops the process of lipolysis in our fat cell or in our adipocytes, which means that if insulin is there, there is no fat breakdown and simultaneously there is fat buildup. That is your lipogenesis, which just now Arunima has told. Now imagine if you have a type 1 diabetes patient. So will there be any insulin available in the body for type 1 patient? Any insulin will be available for a type 1 patient? No, correct?
No.
So if there is no insulin, right? So if there is no insulin, then there will be continuous lipolysis. There will be continuous lipid breakdown, fat breakdown, as a result of which the person becomes thin and there is no fat left, right? So this is another important function of insulin. Is that clear?
Yes, ma'am.
Right. Now let's move ahead to another question. This is called as insulin surge. You all must be aware of this. Can you please help me that when this insulin surge will happen? When
There is
insulin
more
surge
glucose
happens?
in the body.
No glucose in the body. No. Surge means spike, rise in insulin.
Ma'am, after we are having the meal.
Okay, so after the meal, right, after you take the meal, there is an insulin surge. Correct. Now, tell me one thing. If a person is taking rice and if a person is taking candy, then the insulin surge will be same or it will be different? Rice versus candy.
Different, ma'am.
How it will be different? How it will be different? Anyone who can
Glycemic
explain?
index of the candy is higher, so insulin surge will be higher in terms of candy.
Very good. Very good. Which means that when we talk about diet, when we talk about rise in blood glucose level, we are indirectly talking about insulin surge. If there is insulin surge, then definitely at that point there will be a rise in glucose. And here comes the concept of restricted carbohydrate. Do we know what is restricted carbohydrate? Restricted carbohydrate, any idea? The foods which are
Ma'am,
termed
is
as
it
restricted
portion
carbohydrate,
control and complex carbohydrate?
yes, complex carbohydrate, correct. The complex form of carbohydrate, they will release the glucose slowly, and that is why there will be a less amount of insulin release. There won't be an insulin surge. Which means that when you deal with diabetic patient, when you try to control the blood glucose level, actually you must be worried about the glycemic index of the food that the person is taking rather than what quantity of the food the person is taking, right? Now coming to another very common topic that you all discuss, that is insulin resistance, right? Anyone can explain what is insulin resistance? Insulin resistance, what you understand?
Ma'am.
my question,
Yes.
which I ask, what is insulin resistance? And sometimes doctor used to ask for the serum insulin level. When it happens, in which disease or which disorder you find insulin resistance? First you tell, then you can
Type
easily
2
relate.
diabetes. In type 2 diabetes, insulin
No.
receptors of our cell become inactive. So insulin couldn't enter into cell.
Yes, 100%. And other than this, insulin, those who did our class, anyone, batch 3, batch 2,
In PCOD, actually, insulin resistance mostly very
one
common.
minute, 1 minute, only camellia,
Sorry,
only camellia. Everybody mute, please mute, only camellia Bhadro. Yes,
In
camellia.
in PCOD disease, insulin resistance is very common, where actually insulin actually present in our body in sufficient amount, but they cannot act properly.
Yes, so it is perfect. So in the PCOS, we see there is insulin resistance, there is acanthosis nigricans, there is oily skin, there is alopecia, seeing some symptoms, and also obesity is also there in the among the young girls. So even it can happen in the boys also. So we seeing the insulin resistance. The doctor used to ask for the in serum insulin. Now, what is the term mean? How it happens? So it is now coming to Vijaya ma'am's question. What is insulin resistance? Shupana, if you can volunteer. Acha, Shubhadeep Dubey. Shubhadeep, if you can volunteer. Devashruti Roy, yes.
So when excess body fat, especially around your belly fat, and lack of physical activity, then insulin resistance is comes. Any person.
Oh, okay.
So may I?
Yes, try.
So insulin resistance means an impaired response of the body to insulin, resulting in the elevated levels of glucose in the blood. Sir, আমি বলবো? So Suparna here.
Sir, can I
Bolo,
try?
bolo, Shupana, bolo.
Sir, actually what happens when obesity is there or maybe due to PCOD, the receptors in our body that in normal condition senses insulin and passes the glucose into the cell. In abnormal cases like PCOD or obesity, the receptors becomes inactive or insensitive to the insulin, and that is why the glucose cannot pass into the cell. The insulin is the key, and the keyhole is ruptured or maybe inactive. So in that case, insulin cannot be sensed by the receptors itself.
Yes, Vijaya.
yes, correct. Okay, so basically, see, we have to understand one basic concept here. That is, insulin resistance is of different types. Like you all know now, that insulin is a hormone, and that hormone has to reach the cell so that it can help in uptake of sugar, right? That you all know. Now remember that insulin will bind to the cell at insulin receptors, correct? Now there are two different types of insulin resistance that we see. First, where there is no receptor available, which means the receptors which are present, the insulin receptors which were present on the cell, they are damaged, right? That is one condition, one form of insulin resistance. The other form of insulin resistance is that the insulin is coming, the insulin is binding to the receptor, but then the receptor cannot do the next steps. So it is a fault of the receptor, which means that there are two major forms of insulin resistance. One, there is no receptor available. Second, receptor is there, but then receptor cannot trigger the next process to happen so that it can help in uptake of blood glucose, right? Now, coming to the most important part of this section, that is how insulin resistance lead to obesity. You all must have noticed now that obese people or type 2 diabetes, those who are having, they show obesity. That's a very common thing. Can you tell me that how they are related? How obesity and insulin resistance are related? Achha, just now in the very first question, we have discussed one thing. Okay, I'll just give you a small hint here. In the first question, we have discussed one thing, that insulin will stop lipolysis and insulin will promote lipogenesis. Correct? This is one thing that we have learned. Now just imagine, if in a person there is insulin resistance, which means the body is not responding to insulin. Correct? Now, at that point, the pancreas initially starts to produce more and more insulin, because when the body can sense that the blood glucose level is high, then it will forcefully produce more and more insulin. Now, in the body, the excess amount of insulin will cause excess amount of fat production. It will cause excess amount of lipogenesis, and it will stop lipolysis. So ultimately what will happen? All that excess fat will get deposited and it will lead to obesity. Right? Do we understand this?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. Right. Can anyone answer that how obesity is related to insulin? Like, say for example, have you ever noticed that a person who was not diabetic, right, but the person was obese, and then the person became diabetic? This is also a common
Why
case that you must
obesity is related to diabetes?
right, that
Why?
many of the times what
If
happens.
if any interview, Vijaya considered, if in any interview as a dietitian, the interviewer asks that you are a dietitian. So, for example, it is asked to Arunima. So, why obesity cause diabetes, type 2 diabetes? What will be
So
your
should I
answer?
answer? So may I?
Yes, yes, you can answer. It is just an
Okay.
example. Yes, answer.
Actually, obesity means, as we know, there is generally it has been found that there are more number of adipocyte cells, or the fat tissues, fat cells. So the more the fat cells, the more lipoprotein lipase will be there, and that is basically related with the lipogenesis part. That lipoprotein lipase that goes into the liver and activates the C2 apoprotein, that finally carries out that chylomicron and all those things, that basically comes into the adipocytes, and with the help of the insulin, that produces that further, convert into the actually the that's what to say. So I'm sorry, the fat, actually the lipid profile, lipid type of thing. I'm so
Same
sorry, sir.
question if we ask, if you have made the thing complicated, you are answering the right answer. So একটা পেশেন্ট যদি জিজ্ঞেস করে যে আমার ওবেসিটি থেকে আমার কি করে ডায়াবেটিস হলো, আমার বংশে কারো ডায়াবেটিস নেই, এটা
Sir,
আমাদের
may I
ডায়েটিশিয়ানদের
answer?
কাজটাই মেক ইট সিম্পল, নট মেক ইট কমপ্লিকেটেড। বলো
Sir,
বিকাশ।
Sir, the excess glucose gets converted into fats, and that fat generally block the insulin receptors, which is also known as chewing gum effect. I think it's known as
Very
chewing gum effect. And due to this, the insulin in the blood increases and the person gets diabetic.
Insulin resistance happen, the central obesity, due to the central obesity, the insulin resistance happen, and the person gets diabetic. Insulin is not working, insulin get resistance, so that means I am having diabetes. So you have to make it
right.
simple.
What Polomi has mentioned,
Thank you.
that is
Both.
right, and it is
Okay, sir.
called
Okay, sir.
as
Actually, by
1
mistake,
minute, 1 minute. Arunima, please mute. Let ma'am answer. Yes, ma'am. Yes, Vijaya ma'am.
yes. So
What you are
basically,
telling about
this
Polomi? Yes, she's right.
right, yes. So right, so the concept which was explained here, that is called as lipotoxicity. Like she has mentioned that whenever there is obesity, there is excess free fatty acids which will be released, and the free fatty acid will block the pathway. Like we can see now that here at one point we have insulin, and this insulin was taken up by the receptor, and then it was triggering the glut to uptake the sugar. So this pathway will be blocked with this free fatty acids. So that is what is called as chewing gum effect, because it blocks the receptor pathway, as a result of which the glucose will not be uptaken. Right? So that is what is insulin resistance. So definitely obesity will also lead to insulin resistance. Right? So if a person is obese and you're doing
Dubey
counseling
wants to
to
ask
that person,
something.
it is lipotoxicity. It is also called as chewing gum effect.
Okay, ma'am. Thank you.
Right. Now we have learned that what is insulin resistance, and we have even seen that insulin resistance, obesity, they all are related to the type 2 diabetes, correct? Now, those who are already working or those who are already doing counseling and all, whenever you get a type 2 diabetes patient, you always ask them to take medication. Many a times they are given insulin. Other than that, exercise is must, right? We always say that exercise is must for type 2 diabetes patient. Can you explain that how exactly this exercise will help the type 2 diabetes patients? How exercise is going to help?
May I try? Shushma here.
Please try, Sushma.
Sir, exercise helps to increase the cortisol hormone. That will helps to increase the insulin, and that will further increase the lipolysis. So how it will work?
No, it will help to release cortisol. That is fine, and then directly the relation is not that clear. It will release cortisol. That is okay.
And
then
ma'am,
what
the
cortisol will do?
glycogenesis also happen.
Sneha Dubey, you can try. Sneha is raising hand from long time.
Okay. Anyone else?
Sneha, what is your answer, Sneha? Shraddha Chakraborty.
Hello, ma'am. Exercise helps to helps the muscle to release the insulin.
Muscles cannot release insulin.
What happened? We are not clear in the interview. We are not clear with the answer. Then Shraddha, do not
Sir,
answer.
may I try?
Yes. Yes, Suparna, try.
Yes, sir. Thank you, sir. Sir, actually, while exercising, the patient's muscles will uptake the glucose through non-insulin dependent glucose channels, and moreover, exercising reduces obesity. That will reduce the chewing gum effect also.
Okay. Okay, fine. So let me just answer this. So before we understand the relation of exercise and insulin resistance, let us first understand the role of insulin in a normal cell, in a normal muscle cell, right? So what we can see here is that the insulin binds to the insulin receptor, and what is the next step that is happening? This insulin will push the GLUT4. We always forgot about this, GLUT4. Remember, insulin never allows glucose to enter the cell. Insulin never allows the glucose to enter the cell. Insulin only generates a signal so that the GLUT4 open up and the glucose can enter the cell. So the channel, the gate through which the glucose will enter, it is GLUT. It is not insulin receptor. Fine. So whenever there is insulin resistance, then what happens? Of course, the insulin receptor will become inactive. So as a result of which, the GLUT is not pushed at the cell membrane so that it can uptake the glucose. And as a result of which, the cells don't get the glucose, and simultaneously the blood glucose level will rise. This is the condition of insulin resistance, right? Now, what do we do while we exercise? When you do exercise, then like one of your friend has mentioned, that cortisol level will rise, correct? When cortisol level rises, then particularly the muscle cells, they will start producing more and more GLUT. Like say for example, initially there were 10 GLUT molecules which were produced in the cells. But when there is cortisol levels which are high, whenever there is lactic acid formation which is happening, which happens due to your exercise, then there will be increase in GLUT production, GLUT synthesis. So even if there is less amount of insulin activity, then also the GLUT which are being produced, they will reach the cell surface and they will take up the glucose. Please try and understand this pathway. That in case of insulin resistance, while you do exercise, then actually you're not pushing the insulin into the cell. Rather, you are building up more glut. Your cells are building up more glut so that this glut can easily diffuse towards the cell surface and they can uptake the glucose. So that is how your cells starts working independent of insulin. The process is slow, but then it is in a better form than that of having no insulin available. Please let me know if you understand this.
Question is
Please let me know if you understand this. Yes, Suparna.
yes, ma'am. Suparna here. Yes, ma'am. GLUT4 is insulin dependent, and GLUT1 is maybe insulin independent, right? Am I right?
Right. Right.
Yes.
There are actually
okay.
Yes, there are actually 5 forms of GLUT. That is GLUT 1, 2, 3, 4, 5. Particularly, we always talk about GLUT4. Why GLUT4? Because the major cells like adipocytes, liver, muscle, which mainly regulate glucose, they all have GLUT4, right? But then our brain, it has GLUT1. Intestine, it has GLUT2, right? So basically, the insulin-dependent GLUT4, it can even work in absence of insulin if your body is doing random exercise, regular form of exercise. So the glutes will be produced and they will be pushed to the cell surface. Do we understand that how insulin?
This time we have GLUT1, right?
Yes, Devamita. Right.
Ma'am, intestine to GLUT1.
Yes, intestine থাকে, brain থাকে, GLUT2 থাকে intestine. Right, if you remember, galactose, glucose, they have a bi-channel.
Yes, ma'am.
Right. Yes, so this is how exercise can help in overcoming the insulin resistance. Right. So till now we have talked a lot about insulin. We have talked a lot about glucose metabolism and homeostasis. Now let us learn something about sports nutrition and how the different macronutrients are related to sports nutrition. So first, I have a question here. Let's say, for example, a person is doing gym, right? A person is going for gymming, and then the person wants to build up muscle, or the person is a sports person, right? And the person has 2 choices, carbohydrate and protein. So what do you think, which one is more required by that individual?
Protein.
বিজয় ম্যাম অতনু
Yes.
বলছি
হ্যাঁ,
মাসল বিল্ডিং এর জন্য প্রোটিন দরকার হয়, জিম গায়ের জন্য প্রোটিন দরকার, আর স্পোর্টস পারসনের জন্য কার্বোহাইড্রেট প্রেফার।
আচ্ছা, জিম যারা করে তাদের জন্য প্রোটিন দরকার হবে।
প্রোটিন, হ্যাঁ, আর যারা স্পোর্টস পারসন তাদের জন্য কার্বোহাইড্রেট প্রেফার।
ওকে, আচ্ছা, এনি আদার আনসার?
And it depends upon the purpose of the exercise. Like if it is like marathon race, then you have to build up glycogen store in your body. And if it is like weightlifting or throwing a discus, so you need to make the muscles stronger. So carbohydrate and protein both are necessary in that. Is because carbohydrates is protein sparers.
Protein sparers, correct.
To make up the extra carbohydrate like calorie need, so we need to spare the protein for the muscle with the carbohydrate needed.
Okay. Acha. Tale, here I have a question that you must have seen na, that those who are going for gym and all, they always have protein powder, protein shake, whey protein, right? They take multiple protein sources. What do you think that protein is doing to them? Yes.
Protein increases the volume of the muscle cells.
Volume of muscle volume is increased. Okay. Okay. Now tell me one thing, that if you take excess amount of carbohydrate, right, then your body will get energy and the leftover carbohydrate will be stored. It will be stored in the form of, tell me, it will be stored in the form of
Glycogen.
If you take excess protein, then how it gets stored in the body? In what form the excess protein will get stored in your body?
Muscle.
No, muscle is a cell. How a protein will turn into a muscle?
No, ma'am, it doesn't store. It will excreted out through the urine.
Gluconeogenesis. Then the process of gluconeogenesis occurs.
No storage. No, how then gluconeogenesis means glucose is forming up, right? How protein is getting stored?
Protein can store in the body.
Atanu, please explain. Please explain. You're correct.
Sorry,
Okay.
ma'am,
Ma'am, may I?
explain the কথা হচ্ছে না।
Okay, yes. Yes, Shoma.
Ma'am,
Ma'am,
may
may
I? Ma'am, whenever someone doing exercise on that time, the protein muscle become breakdown, and after that, when they taking more protein, that breakdown, which cell was breakdown, that cell coming to be built up by extra protein, and thus the muscle mass being built up, and muscle mass gained more weight.
Okay. Okay. So that is muscle buildup, right? But then protein is not getting
Yes, ma'am.
stored. Right. Protein is not getting stored. Muscle is building up. The muscle cell is building up. Protein is not getting stored.
Yes.
Remember, in our
Yes,
body,
right.
protein never gets stored. Human body cannot store protein. Right? Human body cannot store protein. You can store carbohydrate, you can store fat, but you cannot store protein. So when you take excess protein, which means excess protein will be excreted, and it will be excreted in the form of
Through kidney.
how protein gets excreted? Through kidney in the form of
Creatinine.
In the form of nitrogenous waste products, ma'am.
nitrogenous waste products. Correct.
Urea.
Then urea. Absolutely. So ultimately, you are doing nothing but you are troubling your kidney, you are troubling your nephrons if you take more amount of protein, because your muscle will take that much amount of protein which is needed just to pump the muscle. Because just now Shoma, like she had said, that when you do exercise, there is a muscle tear up and then again muscle join up or muscle build up, and that is how slowly the cell it repairs. Now while it repair, it utilizes the protein, but then it can never store. So protein need is there, of course, but then in a adequate amount. It is not mandatory that everybody has to take excess amount of protein supplements if they go for gym. Now, some of you also said that while someone is doing gymming or exercise, then carb is not that needed. Now, you must be knowing that there are multiple types of exercise. Like one is cardio, like say for example, someone is running on a treadmill, right? So what do you think when a person is running on a treadmill, then what is the source of energy?
Carbohydrate.
Protein.
Glucose. Ma'am, stored
Carbohydrate.
glycogen. Stored glycogen.
Carbohydrate.
Carbohydrate.
It is not stored glycogen, it is instant carbohydrate. Remember, whenever you do any intense workout means very fast, you're doing something, right? So at that time, you need free glucose. Free glucose, of course, from where do you get? Initial blood glucose. If that glucose is depleted, then what will happen? Then there will be glycogen depletion, or else there will be gluconeogenesis, which means that the instant source for intense exercise, it will be carbohydrate. So if a person is going for gym, when the person is doing exercise, the person is doing training, then carbohydrate is a must, right? Carbohydrate, the proportion of carbohydrate is very much important at that particular time. Fine. Now, here I will be discussing about carbohydrate loading. Now, carbohydrate loading is a very common form of diet tool. In sports nutrition, it is called as diet tool. Why it is called as diet tool? Because by using this pattern of diet, basically the efficacy of the sports person is increased. So let me first tell you that how it is done, and then I will be telling you that why it is done, right? So as per this, it is said that a person must lose all the stored glycogen 7 days before the event. Like say for example, a person will take part in any event, right? Any competition, maybe running or something like that. An athlete will take part. So before 7 days, the person must utilize all the stored amount of glycogen which was having by doing intense training. So while the person do intense exercise, definitely all that good amount of glycogen will be lost. Now, after that, the person will stick to a low carbohydrate diet and a high protein diet. Why? So that the glycogen store is less. So first, complete depletion of glycogen, and then there will be a phase of 6 to 4 days where less amount of glycogen will be maintained. And then when 3 days will be left, then the person will start taking high quantity of carbohydrate. Why? Because this high quantity of carbohydrate will help in building up of glycogen. And this glycogen will stay in the muscles so that the person can perform better in the coming event. And just before the night of that event, the person is given a high calorie or high carbohydrate diet, which will again build up, or it will again give the free glucose available for instant energy. So this is basically a process, a trick, which is mostly used in sports nutrition, where the excess carbohydrates forcefully stored in the body, right? And this is done because, like you know, that glycogen is very much required for intense activities, not only for running or not only for your any particular intense activity, also for weightlifting. If your glycogen is less, then of course your muscles are not going to get the strength to pick up the weight. So that is what is called as glycogen loading. So basically, it's not only for the sports person, also for the individual who are going for gym, who are doing a training. It is must that when you do any intense exercise, carbohydrate should be given. Now, can you just tell me that what will happen if you don't take carbohydrate? Like say, for example, a person is doing intense training, right? A person is going to the gym for maybe body built up or something, and then the person is mostly on protein and the less amount of carbohydrate is being taken. So can you just tell me that what will happen to that individual?
Protein sparing action will happen, like muscle loss will happen.
The muscle cramp.
Protein sparing action. Muscle cramp. Okay, muscle cramp is due to lactic acid formation, right? The question was that carbohydrate is less. The carbohydrate taken is being less, more amount of protein is being taken.
Muscle
The
breakdown
person
will
is
occur.
doing intense exercise.
Hypoglycemia may occur.
And muscle breakdown will
Hypoglycemia may
occur.
occur. Okay,
Some weakness will correct.
okay, after muscle breakdown.
Some they feel
Okay,
weakness.
weakness after muscle breakdown.
And the rebuilding of the muscle will be hampered because the protein sparers are absent.
Okay. Just imagine that when the person is doing intense workout, right? When the person is doing intense workout, then slowly what will happen? Glucose, glycogen, all will be depleted, right? And the person is taking more
Then
protein.
fat will
So
be depleted.
fat will be depleted, but then the person is taking more protein. Now, when you are on a keto diet, what happens? Keto diet means what? More protein, right? So when you are on a keto form of diet, when you have more amount of protein, then what is the condition that will develop?
More nitrogenous
Body
waste.
produce nitrogenous waste product in rice. Yes,
Some
ma'am.
ketoacidosis.
Ketoacidosis. Yes, a common thing you all know. Ketoacidosis will happen. Ketoacidosis will happen, yes. So it is a very common condition which mostly happens. Many a time people go to gym and they think that they only have to take protein. They start their day with protein and they take on protein all the time. And again, carbohydrate is very, very limited. They mostly push themselves to salad and protein. So ultimately, they end up in ketoacidosis. Right? So remember that carbohydrate is very much needed, as because it will give energy both to the person who are doing exercise, who are undergoing training, who are doing gymming, and also for the sports person. Now, here we have to understand one thing. Like I told you that in the previous pathway, what we have learned now, that first all the glycogen will be depleted. Remember that in before 7 days, all glycogen will be depleted, and then the person will maintain low glycogen, and then the person will again start eating carbohydrate to build glycogen. Correct? Now, what is the concept behind this? The concept is that, Let's say, for example, let us imagine that muscle is just like a vessel, right? And that vessel can take up glycogen. It can fill itself with glycogen. So the concept is that when you completely make the muscle cells blank and then you start building up glycogen, there is more amount of glycogen that can build up. When you make it empty, and again if your body is starting to build up glycogen, then more amount of glycogen will build up. That is the concept of carbohydrate loading, right? So like that, for sports persons, slowly the muscle cells, they are trained in that way that their glycogen holding capacity is much more than that of any other normal individual. By doing this pattern, their muscle cells are forcefully held in that way so that they can build up more glycogen and they can store it. Now again here we have to remember one thing, that this process when glycogen is building up is called as glycogen replenishment, because first you are depleting the glycogen and then again you are building up, so it is called as glycogen replenishment, right? So at this point when you are giving carbohydrate, then definitely what type of carbohydrate will you prefer? What type of carbohydrate should be given when you are replenishing this?
Ma'am, simple carbohydrate.
Yes, ma'am. Simple carbohydrate.
Simple
Okay.
carbohydrate, ma'am.
Like sugary carbohydrate, or complex, or no, general carbohydrate like rice and all? Sugary carbs
No,
or
general
sugary
carbohydrate.
carbs?
Sugary
Right.
carbohydrates.
Simple one, simple one.
Simple carbohydrate, not sugary. Like we don't want insulin surge. Again, I told you, right? We don't want insulin surge. Remember one thing, glycogen buildup needs time. So this will happen only when slowly the glucose is released, right? So as a result of which, sugary carb is not given in order to replenish. If you give sugary carb at this point, then what happens is that the person will develop fatty liver. Because when the glycogen is depleted, it is not only depleted from muscle, it is also depleted from the liver, because liver also stores glycogen. So when you give sugary substance, then first the liver will catch that sugary carb and it will turn into fatty liver. And then only the muscle will get the next chance to get the leftover sugar. So that is why we want to release slow glucose or slow sugar. Right? Do we understand? Now here we will be discussing few challenges. Now coming to the first one, smoking and atherosclerosis. Like you all know that LDL is good or bad?
Bad.
Bad, bad.
Bad only, bad
Bad.
only.
Bad,
And HDL is good, right?
Good one.
Yes, ma'am.
Okay. So
Yes, ma'am.
why? Okay. So why do you call HDL good?
Because, ma'am, it clears up the blood vessel. When the blood vessel is accumulated with the LDL and the bad fats, so
Okay.
HDL clears up the vessel.
Okay. So basically,
Ma'am,
HDL will carry the fat back to the liver, and
Back to
LDL
the
will
liver
come
and
from the liver and it will deposit. Right? So remember one thing, LDL is bad, of course, but LDL is worst when it becomes deposited. So when we talk about LDL, then we are actually worried about that LDL which can deposit. Now remember, all types of LDL don't deposit. Right? All types of LDL don't deposit. Now let me tell you the reason behind this. Here, can you see three vessels? We will learn this pathway. Before that, just see these three vessels. This is the normal artery, a normal vessel. Now, in a normal artery or in a normal vessel, of course, there is no plaque formation, right? Why there is no plaque formation? Because in the body, there is HDL available. HDL is transferring that fat to the liver cells, and liver is excreting it in the form of bile, or it is utilizing it, right? Now, in case of mild atherosclerosis, what happens? Generally, in what type of individual you expect that plaque formation will happen or fat deposition will happen? When do you expect?
Obese person,
Obese
ma'am.
individual.
Obese person. Or particularly when cholesterol level is high.
High.
Higher than normal.
Cholesterol Why? Because in presence of free cholesterol or esterified cholesterol, that is CE, esteril cholesterol, and FC, that is your free cholesterol. When they are present, then what do? They help in deposition. So you get this type of condition, that is your mild atherosclerosis. But the same thing can turn into a severe form of atherosclerosis. This is another condition, that is severe form of atherosclerosis. And when this will happen, let me tell you. This will happen when a person is producing free radicals. We all know what is free radical, right? Free radicals, they can produce oxidative stress. And you also know that smoking is a major cause behind free radical production. Which means that if a person is having free radicals in the body, then the free radical will bind to LDL. Please understand this. Free radicals will bind to LDL. It will turn LDL into oxidized LDL. So like I told you, all LDL is not bad. The LDL which is oxidized, right? The LDL which is oxidized, which is attached to the oxygen, the free radical oxygen, that LDL will be captured by the macrophage. Macrophage is our immune cell. And this captured macrophages, what do? They form a lump. And this lump is called as foam cell. And now this lump can easily deposit in the arterial wall. So when a person is undergoing this process of smoking, there is free radical production. When there is free radical production, there is oxidation of LDL. Oxidized LDL is uptaken by the immune cells, macrophages, and they form the big chunks of deposit called foam cells, and they form big plaques in the arterial wall. Which means that if a person is a chain smoker maybe, and the person is having very less amount of cholesterol available, then also the person is at a very high risk of atherosclerosis. Right? Do we understand this?
Yes, ma'am.
Now, of course, when we always talk about biochemistry in MNT, then one very important thing is report analysis, because being dietitian, being nutritionist, when you sit at a clinic or when you visit your patients, then definitely you must be aware that how to read a report. Like here I have particular instructions which are given, and can you just interpret that what could be the possible condition here. There's a person who is showing jaundice. The person is also showing anemia. The person is having UCB. UCB is unconjugated bilirubin, right? So in this condition, can you just interpret that what could be the possible condition? What is the disease?
Hepatitis.
Hepatitis, no. Just see, jaundice is there, anemia is also there. And unconjugated bilirubin is high.
Liver cirrhosis.
No.
And liver disease?
Ma'am, is it hemolytic jaundice?
Hemolytic jaundice. Very good. It is hemolytic jaundice. See, anemia means what? That the RBCs are less, the RBCs are dying, right? So it is hemolytic, RBCs are dead. And when RBCs die, then what happened? The bilirubin concentration in the body will build up, it will grow, and that will cause jaundice. So this is a hemolytic jaundice. This is just an example, right? It is not possible for you to just look at any particular report and find out what is the disorder. But then it is very important that you have an idea that what could be the pattern of disorder. You must be aware that how to read the reports, right? That is a very important function of biochemistry in MNT. Those who are already enrolled, they will very soon learn how to do it, and those who are already passed out, they definitely know that how helpful it is. Now, like I was talking about interpretation, that you must interpret, that what you get to see, you must interpret. Like say, for example, lactose intolerance. We all know, right? What is the symptom of lactose intolerance? Anyone?
Ma'am, this is Arunima. May I?
Okay. Yes.
Ma'am, first of all, we could develop some allergies like rashes, fever. and after that some diarrhea may be there, and something related to some problems related to gut like indigestion and this type of things.
Indigestion, bloating. Okay, correct. Can anyone tell me what is the symptom of galactosemia? Galactosemia. This is also a common condition. Okay. Achha, we know lactose, right? Lactose is what? Lactose is the milk sugar, right? And when this milk
lethargy.
sugar, lethargy. Okay, so when this milk sugar is not getting broken down, when this milk sugar is not undergoing the process of digestion, we start calling it as lactose intolerance, and that is of course due to the absence of the enzyme, right? That is lactose intolerance. Now, what diet
Like
you generally give?
Bija, just I want to interrupt. Just I want to interrupt in this. This will be taught in our MNT classes, both in food allergy intolerance class. We will do this, and also Komal ma'am will teach us in the gastro liver disease. So this is very important. Why I am saying, when you will use the pediatric nutrition supplements, so there it will be clearly written that it can be given in the lactose intolerance children, but not in for the patient of galactosemia. So now, right at this moment, you have to clear the concept what is lactose intolerance and what is galactosemia if you do not know. And whatever ma'am is giving inputs today, যে কথাগুলো ম্যাম আজকে বলছে সবগুলোর নোট নাও, and also you go through the net and clear your doubts. All the topics today chosen by ma'am is very, very, very important topic in your clinical practice. That's why we have chosen these things. Okay, so just I have related with our practice how lactose intolerance and galactosemia is important, and also in the nutrition supplement how to choose the nutrition supplement. So we have to be very alert. So in the 100 patients, you can give 50 patients of lactose intolerance, but galactosemia maybe not even one. Okay, so let's again, sorry to interrupt, Vijay, you can just continue.
No, that's fine. So basically, like I was telling, that the symptoms of galactosemia and lactose intolerance is exactly same. But if you give the food supplements which are used for lactose intolerance to galactosemia patient, the child may die within 1 week. Which means that it is very important to understand the difference. And how do you do that? You do that by asking question to the parent, that whether there is any other history of child death. Like say, for example, it may happen that there was any other previous child who died within 2 days or 3 days or 4 days. That means that that particular case can be a case of galactosemia. Now, here only one point you have to remember, that is in lactose intolerance, like you know, that the lactose is a dimer, right? It contains both glucose and galactose. But when you talk about galactosemia, we are only dealing with the galactose, which is a monosaccharide, which means that the person who are suffering from galactosemia, if you are trying to help them, then you cannot give anything which is related to milk. You cannot give them anything which is even related to galactose. You have to solely depend on glucose sources, right? Now, once we start discussing about this, we have this in our module, which is very much clear, very much elaborate. There you'll be learning it. From here, what I'm trying to imply is that it is very important that when you learn about the diseases, when you learn about the conditions, make sure that you can interpret them right. And in order to do that, you need to have a clear concept of it. Another most important challenge that you will be facing is patient counseling. Like one condition is diabetes and stress. Many a time people fail to understand that the stressful condition which they have, that is actually leading to diabetes. Can you please help me that how stress can lead to diabetes? Anyone? How they are related?
আমরা বলি না চিন্তা করবেন না, চিন্তা মত कीजिए, স্ট্রেস को हटाइए, সুগার बढ़ जा रहा है, সুগার বেড়ে যাচ্ছে স্ট্রেসের জন্য, কিভাবে রিলেটেড? এবং আমরা অনেক পেশেন্ট পেয়েছি ওই সময় আমার বাড়িতে খুব স্ট্রেস চলছিল and I have developed diabetes. এটা অনেক সময় পেয়েছিল. So yes, Shoma, try.
Sir, whenever we are going through a stress condition, there is cortisol production in our body, and when the cortisol presence in blood, insulin will be inactive.
Good. Very good. Correct.
You, Shoma, this is the concept. She has given the answer in a very simple form, and this is called the concept. So you need to be clear on your concepts. Okay.
Absolutely.
Thank you. Now see the pathway.
Yes.
Now madam will discuss the pathway. Please pay attention.
Right.
It is not difficult.
So like when
don't get tense to see the slide. Okay. There are a lot of things today we are discussing, but all the things will be in an elaborate way during our MNT classes. So we are giving the glimpse of the things.
Right. This is just an introduction. So, like Shoma has just now mentioned, that whenever there is any stressful condition, then basically there are three major types of responses that the body will create. That is neuroendocrine, where the hormones will be released, inflammatory response the body can generate, and again the sympathetic nervous system can also get activated. So as a result of which, what happened, the muscles, they break, and the broken amino acids which are released, they enter into the liver for gluconeogenesis, and glucose is produced. Simultaneously, the fat, the adipocytes, they also start getting broken, and again they release that same glycerol, which will again turn into glucose. So that is how the body indirectly enter into this phase of gluconeogenesis, where a rise of glucose is being noticed. So in a stressful condition, the metabolic changes that we see, it is mostly due to the cortisol levels. If the cortisol levels are high, then definitely central obesity is observed. Along with that, high levels of lipid. There will be lipid buildup that will be seen, and then there will be gluconeogenesis which will be occurring. Simultaneously, as because it shows the inflammatory response, so it will stop the activity of insulin, like she has mentioned. And as a result of which, the glucose levels will again automatically rise. It will also cause telomere shortening. Can you please tell me what is this telomere shortening and how it is related to us? Telomere shortening. কি হয় telomere shortening হলে?
Ma'am, may I?
Longevity কমে যায়?
Yes, Suparna.
Yes, ma'am. Telomere is the part of our chromosome. It's the end part of the chromosome. If stress is there, it causes free radicals and the inflammatory process, which reduces the telomere length. And in future process, it is responsible for the cell death also. So the decrease in telomere length is related with cell death, apoptosis.
Correct. Absolutely. So it is apoptosis, cell death, or you can say cell damage, aging, all that is related to telomere shortening. So if there is stress, if there is telomere shortening, then ultimately there will be quick aging and there will be cellular damage. And again, we see that it will affect the insulin sensitivity. So first of all, insulin production will be decreased, and simultaneously the insulin sensitivity will be also decreased. So the receptors will also start working less. So as a whole, the diabetic condition will definitely develop. Okay, now here I have another particular concept where we'll be learning that how to apply the theory into the practice. Like here I have taken two vitamins, right? That is C and E. Can you tell me what is the common thing between these?
Antioxidant, ma'am.
Antioxidant.
Antioxidant, ma'am.
Antioxidants. Okay. Both are antioxidants.
Both are acidic in nature.
Acidic? No, not really. Vitamin E is not acidic. Okay.
And vitamin C is water soluble and vitamin E is fat soluble, and both are natural antioxidant.
Okay, both are natural antioxidant. Fine. Actually, tell me one thing, that vitamin C, like you know that it is water soluble, so we have to take a continuous supply of vitamin C, right? We always tend to take vitamin C. Vitamin E, you know that it is fat soluble. So as a result of which, if you take it, it will get stored in your fat cell and slowly it will utilize itself, right? Now tell me one thing. Say for example, a person is taking vitamin E, right? But then the person is not taking vitamin C. The person is only taking vitamin E. And the person complains that there is no benefit of vitamin E that the person can see, which means no particular benefit of vitamin E the person can experience. You understand the question? That in absence of vitamin C, the person cannot see any benefit of vitamin E.
Ma'am, may I try? Hello?
Yes, please.
Yes, because the free radical scavenging reaction, their vitamin C and E both are used in the same reaction. So if one is absent, that then the reaction couldn't go. The reaction stopped. So the benefits are not seen. Only taking vitamin E.
Okay. Any other answer? Okay. Let me just clear this to you. You're partially correct, Suparna. Basically, vitamin E, like I told you, that vitamin E will be stored in your fat cells or in a fat soluble form in your body. Now remember, vitamin E needs recycling. Why I say that vitamin C is important? Vitamin C will help vitamin E to recycle, which means that if you don't take vitamin C along with vitamin E, then what will happen? The vitamin E will not get recycled and your body will use vitamin E only for once. If you have vitamin C available in your body, then that same vitamin E will start rotating, it will start getting recycled, and you will get the benefit of vitamin E. Now, this is what is called as synergic effect, right? Is there any other example of synergic effect like you remember? Where any other vitamin or mineral that we take together or we don't take together?
Vitamin C and
Vitamin
iron.
D or iron.
Vitamin D and calcium
Vitamin C and
also.
iron. Okay, what is the relation? Okay, very good. Vitamin D and calcium. Can you please explain? How?
I think
Vitamin D and
pyridoxine,
calcium are
niacin, and riboflavin is also there.
with what?
Pyridoxine, niacin, and riboflavin. They are
Yes.
both connected.
How they are related? Like, let me just give you one particular example. Like we all know, na, calcium. Calcium is, of course, it is very much available in many of the food items. Like one such item is spinach. In spinach, there is very a good proportion of calcium which is available. Can you tell me that the calcium which is present in spinach, can our body absorb that calcium? Is there anything
Ma'am,
else
not
which is
really
No, ma'am.
because oxalate is present in
Oxalate is
spinach.
present.
very good?
Oxalate
So
is
there is
present.
oxalate which is present. Right. There is oxalate which is present. So oxalate will form a salt of calcium, and as a result of which the body cannot absorb it. Simultaneously, if you are taking calcium and simultaneously you are also taking magnesium, there is excess amount of magnesium there in your body, then also your body cannot uptake that calcium. Why? Because the calcium will combine with magnesium and it will form a salt which is called as hydroxyapatite crystal, which will again stop the absorption of calcium. Which means that if we talk about vitamins and minerals, it's not like that we can take all the minerals together or all the vitamins together. Why? Because they do have a antagonist and a synergic effect. Synergic effect means the vitamins or minerals which are supposed to be taken together, and antagonist which you cannot take together. So particularly vitamin C and E, they show the synergic effect where in absence of vitamin C, there is no recycling of vitamin E and it becomes useless. Right? So we cannot take all the minerals and vitamin together. Do we understand this?
Ma'am, is there any antagonistic effect with calcium and iron? If they are
Calcium and
both
iron.
present, you know,
Yes,
if
calcium
they are
and iron
both
is
present,
also there.
then
Calcium and iron is also there. If you take excess
For
amount of calcium,
if you can take dates
yes,
with milk.
Shobhanu sir. Yes.
If we there is a very common combination দুধের সাথে খেজুর খাও, dates with milk. Komal ma'am was present for a long time. I think she has left. She has taught this in our class. So what is the relation? Why it is antagonistic? So anyone can answer. Is it a good combination or not? There
No,
are
sir,
many
because
things.
it binds to the same receptor. So
True.
Right.
Yes.
So again, they cannot get absorbed together. Right. So it's of no use. Yes. So the basic motive of today's class is just to make you understand that if you are in the practice of nutrition, or if you want to be a better dietitian, then definitely you must include biochemistry. You must understand the basic concepts, and at the top of which you must remember that theory is never going to help you unless and until you bring it into your practice. Right. So this is our effort that we are trying to make, just to bridge this gap. And hopefully, in coming future, we will again come up with some new topics, some new discussions, and we will continue this path that we have taken. I'm open for questions. If any question or any suggestion.
So thank you, ma'am, for this beautiful session and clearing few concepts. We have a lot of confusion still date, and always it is my perspective or my belief that our mothers in our childhood were the best dietitian. Suppose we are having diarrhea, loose motion, we are having fever. So the mother used to give some kinds of food during diarrhea, loose motions. So they are coming as a trend. So these are all good. Nothing is wrong. Maybe they do not know the scientific base, but they are giving in a right way. Obviously, there are myths in the families also. I am not saying that each and everything is correct. But when you are preparing a diet chart, diet plan, or any interview, you are facing any interview, the interviewer do not intricately judge on your calculation part, that how much protein. Obviously they will see how much, but tally করে দেখবে না যে ঠিক আছে কিনা. They were checking, this is my experience, Vijaya, they were checking on the concept of the menu plan and prioritizing. So patient is having tuberculosis with CKD, which you are prioritizing. So first we need to treat TB, then we can treat with the CKD, which is long term. So first we have to treat the short term complications, then we will go for the long term complications. Obviously, chronic things, hyperacidity or chronic constipations, even sometimes patient used to complain to you when they are giving the recall that I am having diabetes along with some hyperacidity and constipation. So at that time, we are not focusing on the chief complaint of the patient. We are only focusing on the diabetes, how to manage diabetes. So these are the few examples which may or may not be related to this class. So I am open for the question. So Nagma, Parvin, one by one, we'll have 10 minutes or 15 minutes time. We'll take the question. Nagma, Parvin.
Yes, sir. So there
Yes.
was some technical piece I cannot understand the concept behind why a person should take only taking carbohydrate and not taking protein. You know, what happens when a person is taking only carbohydrate and not protein?
Carbohydrate load. Her concept is not clear, Vijaya.
Okay, she's asking that if what will happen if a person takes only carbohydrate and no protein, right?
Even
that is what you asked.
Too much of carbohydrate. You are asking too much of carbohydrate, but very less or no protein.
When a person is taking only protein, not carbohydrate.
Ulta. Acha, keto.
Okay.
The ketoacidosis. Ketosis.
Ketoacidosis will happen, right? Because what you know, that if there is no carbohydrate available, then what will happen? Your body will try to derive the energy from the protein. And in order to do that, it will end up producing ketone bodies. Excess amount of ketone bodies will lead to ketoacidosis. Right? Do we understand?
Just you have to check, Nagma. No, you have to go and check. In a one sentence, ma'am cannot explain you. And this is nothing that you don't know. We have to learn here. Ketoacidosis is something from our graduation or from class 12, we learned that what is ketoacidosis. So Nagma, it is your homework that you will come back with ketoacidosis. What is ketoacidosis? Deficiency of carb in the body lead to ketoacidosis.
Yes. In one line, what I can say is that if you check the ketone bodies, there are 3 major ketone bodies which are formed, right? So all the ketone bodies have COH, that is acidic group in them, right? And that is the reason why they are keto, they are ketones. So as a result of which the blood pH will change. The blood pH will become acidic. So that condition is called as ketoacidosis. Fine. You can check more if you want. Please do that.
Huh. So before going, there are 5 raised hand: Orunima, Shraddha, Shoma, Kaustubh, Riyanka. So Shraddha, Shoma and Orunima, you have interacted. I am coming. First, I am taking question from Kaustubh and Riyanka. Kaustubh, what is your questions? And if anybody is at home, you can switch on your video so that ma'am can see who is Kaustubh or who is Shoma.
আমি এখন তো ফিরছি, বলছি আমার কোশ্চেনটা
কোশ্চেনটা বলো।
ম্যাম একটা পোরশনে বললেন যে ওই ভিটামিন সি আর ভিটামিন ই এর সিনার্জিস্টিক ইফেক্টটা, আমি ওই জায়গাটা আরেকবার বুঝতে চাই।
আচ্ছা, আমি বললাম যে ভিটামিন ই আর সি এই দুটো সবসময় একসাথে নেওয়া উচিত। মানে ভিটামিন সি যদি তুমি শুধু নাও তাহলে ইউ উইল গেট দ্য বেনিফিট, বাট যদি তুমি ভিটামিন ই নিচ্ছ বাট তার সাথে তুমি ভিটামিন সি নিচ্ছ না, তাহলে কিন্তু তোমার ভিটামিন ই যেটা বডিতে আছে সেটা রিসাইকেল হবে না। ঠিক আছে, ভিটামিন ই কিন্তু অক্সিডেশনও হবে, রিডাকশনও হবে, এন্ড দ্যাট ইজ হাউ ইট উইল ফলো অল দ্য মেটাবলিক পাথওয়েজ। এবার এই অক্সিডেশনের রিডাকশনটা করানোর জন্য, সাইকেলটাকে চালিয়ে রাখার জন্য ইউ নিড ভিটামিন সি। সো ইফ দেয়ার ইজ নো ভিটামিন সি, your vitamin E will fail to do the job. তাই জন্য এটাকে বলা হয় synergic vitamins, যে ভিটামিন ই এর সাথে সবসময় ভিটামিন সি নিতে হবে।
আচ্ছা Vijaya, my next question related to Kaustubh is vitamin E is a fat soluble vitamin, whereas vitamin C doesn't lead to hypervitaminosis. আমরা বলে থাকি ভিটামিন বি কমপ্লেক্সলি সি এর ওভারডোজিং হয় না because it gets excreted through the urine. But what will be the dose for vitamin E if we are considering vitamin C, taking vitamin C for some purposes, and we cannot make through our diet, we cannot combat through our diet? So what should be the like doses for this? Though the physician will decide, but still this is my question for you, because diet e jodi আমি বলতে চাই যে ভিটামিন সি খাচ্ছি, একটা পেয়ারা খাচ্ছি, দেন ভিটামিন ই খাচ্ছি উইথ আমন্ডস, সো কতটা আমরা পাবো আমি জানি না। হ্যাঁ, কিন্তু if we are taking in the form of supplements, so what should be your answer? Or if you should take the supplement together? অনেক সময় আমরা ডাক্তারকে কখনো দেখিনি যে ভিটামিন ই প্রেসক্রাইব করেছে, হয়তো সি করেছে, জিঙ্ক করেছে। হ্যাঁ, যেমন ক্যালসিয়াম ডিটা, ভিটামিন ডি থাকেই, ব্যাপারগুলো একসাথে খেতে বলা হয় যে আপনি রাত্রে ক্যালসিয়াম ট্যাবলেটটা খাবেন, ভিটামিন ডিটাও খাবেন। যদিও আমরা এভরিডে ভিটামিন খাই না, we are not taking vitamin D every day, once in a week, but still the sachet should be taken with milk or any calcium based product, so the absorption will be more. Same for the C and E, how to take or when to take in the body.
Okay, C to like we can take any time, like you said ki C jodi beshiyo hoy it will be excreted, so it's not a problem. E jeta hocche, E is very good in storage. E body kintu onek din, vitamin K and E এই দুটো কিন্তু অনেক দিন বডিতে থেকে যায়। সেই কারণে if we have excess amount of vitamin E, তাহলে যেটা হয় the fat cells they store it and they store it. many a times দেখা যায় যদি ইভিয়ন ট্যাবলেট যদি খাওয়া হয় ভিটামিন ই এ, খুব শিগগিরই ওয়েট গেইন হয়, এটাও দেখা যায়। সো ভিটামিন ই পার্টিকুলারলি ইন এক্সেস সেরকম কোনো ডিসঅ্যাডভান্টেজেস হয় না, বাট হ্যাঁ স্মল অ্যামাউন্ট হলে দ্যাট ইজ মোর দ্যান এনাফ ফর দ্য বডি।
Okay, thank you. So now I'm coming to Riyanka, dietitian Riyanka.
Good evening, sir. Good evening, ma'am. Sir, my question is, what type of diet can I suggest to the injured sports person?
Okay, injured. Okay, first of all, you have to check that what type of injury the person
What kind of injury is it?
Is it? Can okay, it can be
এক্সারসাইজ করতে কোনো ইনজুরি এসছে, তো সেক্ষেত্রে
আচ্ছা, বেসিক্যালি যদি মাসেল টুইচিং
ফার্স্টে
হয়
আমি
তাহলে সেই
একটু
ক্ষেত্রে
বলবো
প্রোটিন নিতে হবে। হ্যাঁ 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 অবশ্যই।
না, ফার্স্টে দেখো ম্যাডাম তো কনসেপ্টটা ক্লিয়ার করবেনি। ফার্স্টে দ্য পারসন হোয়াট টাইপ অফ এক্সারসাইজ হি ইজ ডুইং ইন দ্য জিম, ফর হাউ লং হি ইজ ডুইং, বিকজ ইনজুরি আসার চান্স কিন্তু তখনই যখন হি ডান সাম মিস্টেক অর ইন দ্য প্রাইমারি স্টেজ, যে প্রথম এক্সারসাইজ স্টার্ট করেছে ইনজুরি এসছে, বাট বা হেভি লোড তুলতে গিয়ে দ্য ওয়েট লিফটার অর দ্য বডি বিল্ডার, so obviously protein will be required in a excess, maybe it is 1.5 or 1.6 or maybe below 2, but we need to check that during injury the patient is also not doing exercise, so too much of protein can be load for the patient. It can lead to kidney problem because patient is in a small period of time, patient will not develop kidney problem, but if the patient is taking unnecessary excess protein or the protein supplement, and obviously out of the 3 protein, casein, soya and whey, you know, for muscle building, which protein is good? Which protein is good? Whey protein. Whey protein is very good for muscle, so that is very very important for to check. Now scientifically I am coming to Vijaya, because the question is also not complete question. Okay, yes,
Right. Yes, so injury, basically if it is a muscle injury or a muscle twitching, then basically to repair protein is very much required, but in case it may happen that there is an infection, হয়তো কোথাও হয়তো injury হয়েছে and then it has turned into inflammation or an infection, then first criteria is to low down the infection, right? First criteria is to reduce the inflammation, and then you will switch over to protein or to carbohydrate. So as a whole, basic injury te protein high রাখা হয়, but then if it is inflammation, then definitely তখন কিন্তু আমাদের প্রোটিনটাকে লেস রেখে আগে ওয়েট করতে হবে, so that the inflammation is reduced and then you can start the process.
okay. So next question, I am telling in a sequence the name, so the question will be Arunima will ask, then Shaurodip, then Shraddha, then Ashruti, then Shoma. 5 question raised, then we will close the session. Yes, Arunima, please.
Hello, ma'am. Ma'am, first of all, I would like to say sorry for being confused in between in just a single question. After that, I gave the correct one. So I'm so sorry for that because of some disturbances. So my question is not exactly from that, but I'm, ma'am, very much keen to know that answer. If you please help me in this.
Okay.
So, ma'am, may I?
Yes, sure.
Ma'am, in my I'm doing internship in Techno Global Hospital. So in a case study, what I have found that a person is having diarrhea. So in case of that, a doctor is suggested bland diet. That is lactose and they are thinking that bland diet means lactose and gluten-free diet. So in the mid morning, the patient are given, if it is a soft diet, the patient are given papaya. So when a patient is given papaya, our senior ma'am asked not to give him because she said it contains papain enzyme. So I want to know what is the role of papain enzyme in alleviating the diarrhea. Is there any effect, ma'am?
See, papain is actually believed to be good. Why? Because it has a proteolytic activity. That is the best part of papain.
Right,
and as because proteolytic activity is there, so it is generally considered to reduce any infection, whether it is your bacterial infection or a fungal form of infection, it is believed. So in that case, I don't believe that it can exacerbate your diarrhea condition. I don't believe so. It can be good.
Right, right, ma'am. When I asked ma'am said because it contains papain enzyme, that's why I am asking you not to give. So we replaced it with the green coconut water.
Okay, but as per my understanding, I don't believe it would be a harm.
That means, ma'am, there is no scientific basis of that not giving papain at that time while in diarrhea, right, ma'am?
Yes, because like I said, it can be good because it has this proteolytic activity, so it will help the patient for easy digestion or better digestion, and you can say for smooth digestion. So that's a good part of papain.
From my last 15-16 year practice when I was in hospital, even my senior used to give it. I have learned from her. So pepe diye chicken ke mekhe rakha, marinate chicken with papine, so it make it easy to
Tender.
digest. Digestion, yes. So these are good even for the same for banana. The kathali kola or the ripe banana is good both in the condition of diarrhea as well as constipation, because it is soluble in fiber. So when you are making a diarrheal diet, you may add a small banana with 1 or 2 teaspoon of carb in combination, prebiotic and probiotic combination. Okay. So Shaurodeep, then
Thank you, sir. Thank you, ma'am.
Kriti Topa is a practicing dietitian in a hospital. So after Shaurodeep, I will take Kriti Topa, then I will go to Shraddha. Shaurodeep, your answer, and requesting you, like Shaurodeep has switched on the video. So requesting you, whenever you are asking question, if possible, switch on the video. Yes, Shaurodeep.
গুড ইভিনিং ম্যাম, গুড ইভিনিং স্যার। আমি একটা জিনিস জানতে চাই ম্যামের কাছ থেকে যে সিম্পল কার্বোহাইড্রেটের জায়গায় সুগারি কার্বোহাইড্রেট যদি দেওয়া হয় তাহলে সেটা ফ্যাটি লিভারটাকে কি করে বাড়িয়ে দিচ্ছে, এটা একটু যদি ম্যাম একটু এক্সপ্লেন করেন তাহলে ভালো হয়।
এটা খুব আবার again it is a not a short answer. So okay চলো।
ঠিক আছে, I will try to make it simple. আচ্ছা, see, complex carbohydrate means slow digestion, আস্তে আস্তে গ্লুকোজ রিলিজ হবে। আর যদি সুগারি কার্বোহাইড্রেট হয় তাহলে কি হবে, খুব ফাস্ট গ্লুকোজ রিলিজ হবে, খুব ফাস্ট গ্লুকোজ ডিফিউজ হবে ব্লাডে। এক্সেস গ্লুকোজ সব সময় সব থেকে আগে যাবে হচ্ছে লিভারে। লিভার যখন এক্সেস গ্লুকোজ পায় সেটাকে সে কনভার্ট করবে হচ্ছে ফ্যাটে, and that fat will be stored in the liver and it will be called as fatty liver.
If you can mix and match in Hindi and English, so that Hindi and Bengali, so that other also can understand. The question was why simple sugar is bad for, why simple sugar is bad for a liver patient or the simple sugar.
Liver patient.
Yes.
For everyone actually, for everyone. क्योंकि जब जो शुगर है, शुगर क्या है, शुगर का काम is to break and to get diffuse in blood. और ब्लड में जब ये शुगर घूमता है तो फर्स्ट ऑर्गन दैट इट विल गेट इज लिवर। नाउ व्हाट लिवर विल डू, जब ज्यादा शुगर आ रहा है तो लिवर उस शुगर को कैप्चर करेगा और कैप्चर करके एक्सेस शुगर को कन्वर्ट कर देगा फैट में, फैटी एसिड्स में, ट्राइग्लिसराइड्स में, एंड दैट विल बी स्टोर्ड इन दी लिवर सेल्स। और जब ये फैट स्टोर हो जाता है लिवर में तो उस कंडीशन को हम बोलते हैं फैटी लिवर। राइट, डू वी अंडरस्टैंड शौरदीप? क्लियर হয়েছে?
Okay, so again take it as your homework, get it cleared, the concept from YouTube or net, and again you are already our student of new batch, so it will be get cleared in our courses. Okay, so we have 5-6 classes on liver, 4-5 classes on gastro, so it will be get cleared. Thank you, Shaurodeep, nice question. Kriti Topa Dotto.
Yes sir, good evening sir, ma'am. Actually, I had this confusion. Like, basically, we have this concept that while treating diabetes patients, we give complex carbs. But if a patient is also going to a gym, regularly attending a gym, so for that, do we give simple carbs to that patient, or we treat it as a normal diabetic, like giving them complex carbs as we treat any diabetic patient? What do we do?
Diabetic patient who is going for gym, right?
Yes. In
now
like attending an
excessive intense exercise. Very good question. Actually, this is a very controversial topic. Many a times it is believed that diabetic patients should not go for intense workout. This is one particular condition that is always mentioned. And the reason being that if the person is going for intense workout, then there will be a quick fall in the sugar level, which the diabetic patient cannot tolerate. Right? So that is a very good question. So basically, if the diabetic patients are even going for your gymming, then they must not go for intense workout. Right? Like workouts, I'm not sure that whether you are enrolled for the MNT course or not. We have classes on type of exercise there we will be discussing.
Yes, I'm here.
Okay. So we have classes, they will be discussing that what are the different forms of exercise. So intense exercise is not for them, because when we look for intense exercise, yes, then we need
basically ma'am,
yes,
basically ma'am, what happens, like I've got some patients who actually are diabetic. Once they are diagnosed, they generally go for instantly they go for a gym. And basically what happens is more or less the gym trainers they make them do all types of cardios and which are very intense and
Right.
which is not suitable for them, and then cramps occur and many other things related occur which I'm not very sure about. I'm not in that depth, but then they come back and say that what happened, like I cannot do any more of gym
Yes.
and then my reduction is not happening.
Correct. Because they are
What
not
do we
taking
do?
that free sugar, right? We cannot give them that free sugar, right? So that is the reason
So
why
what
the
do we
instruct. Yes, actually, this is not the role of a dietitian. This is the role of a gym instructor. They should be aware of what type of exercise they are actually recommending to the diabetic patient. Diabetic patient should not go for random cardio. That is very
Okay,
important.
so we should tell them. We should
Yes,
tell them before.
they should be informed.
Okay. Thank you, ma'am. Thank you.
Thank you, Krititapa. And it's a very common question asked by her. Also, my questions. Shoma said that she got her answer. So now Shraddha, Astruti, and Sanyapal. Then we will wind up the session. Shraddha, if you can switch on your video and ask your question.
Hello, sir. Hello, ma'am. Thank you for the enriching session. Ma'am, my question is, you told that the exercise is important to raise the GLUT4 receptor level. So, should there be a certain time, like for 30 minutes or 10 minutes or exercise? Like, is there any time that which is required to raise the GLUT4 level?
Okay. Basically, I have mentioned that cortisol release. Cortisol release is going to help us in enhancing the production of GLUT4, right? Now, cortisol will be released whenever there is a adrenaline rush. Adrenaline rush, while we do exercise, and what we see that many a times after 5 minutes, somebody is feeling that adrenaline rush. Maybe for someone after 15 minutes, that person is feeling that adrenaline rush, right? So we have to do the exercise till we reach that adrenaline rush and the body persists with it. Do you understand? So while you do the exercise, you have to get that effect of adrenaline rush where the person starts sweating, there is redness, there is high intensity breathing, right? So that is the condition where there is adrenaline rush and there is release of cortisol, right? Once the cortisol is released, the cells will start their activity of building up more fluid.
Heart rate also increases.
Is
That
that
can be
clear, Shraddha?
also a condition.
Yes. Yes, absolutely. Because the breath rate will increase, so definitely the heartbeat will also increase.
Okay, so it can differ for people to people.
Yes, because for different person, the adrenaline rush can be different. It may happen somebody can persist for 10 minutes, somebody can persist for 15 minutes, right? But we have to do it for that particular time till the body reaches that particular stage of adrenaline rush or cortisol release.
Okay, ma'am. Thank you.
Anushwa, no question. Anushwa Haldar. Astruti Thakur, then Sanyapal. If you can switch on your video.
Presentation?
Yes,
Will it
yes,
be
yes.
okay?
Stop the presentation. Yes.
Okay.
Yes, Astruti, you can continue with your question.
Good evening, sir. Good evening, ma'am. My question is, other than smoking, how are free radicals produced?
Okay. Free radicals are produced by multiple ways, like you know, like there can be
Just you need to stop sharing the screen.
Actually, I'm exiting this particular device. I'm still here.
Yes.
Right. So, yes. So basically, oxidative stress occurs due to free radicals. Now, free radical comes from multiple sources. It can be due to excessive obesity. It can be due to the lipolysis. Lipolysis is another important process where the free radicals are released. It can even happen in the body due to the absence of antioxidants. Many a time we don't take right amount of antioxidants. So there is accumulation of free radicals in the body. Right, and then of course the other physical conditions like radiation is there, then the exposure to unknown chemicals are there for which the body cells they start releasing free radicals. Am I clear?
Yes, thank you.
Yes, Sanyapal. You are on mute.
Yes. Good evening, ma'am. I am a big fan of your class. Okay, but I am not
Thank you so much.
able to do a whole class for my traveling
She
issue.
she is working in a multi-specialty hospital and senior dietitian there. But she was
Yes,
our
yes, I know
old
her.
student. She is our old
Right.
student. Okay,
Ma'am,
sorry.
I one question. Sometimes people ask for michri. Can we take michri? But I don't know what is the component of michri. Is it akher ros or
It is a
tal?
simple sugar.
Simple
What
Simple
is
sugar.
it? It is a simple
But
sugar.
ma'am,
Just
if one patients have no diabetes comorbidities, but patients have high potassium like 5.6, he can take.
Mishri is basically like Shomanjuda say, it is nothing but crystalline form of sugar. That is all. যে সুগারটা আমরা নর্মাল মার্কেট থেকে আনি ওই সেম জিনিসটাকে ওরা ক্রিস্টাল করে মিশ্রি বলে বিক্রি করছে that is the basic thing that I know. Shomanjuda, if you can add something to it.
it is just an eye wash to the people, tal misri or whatever. So it comes from taler rosh or it comes from khejurer rosh or whatever it comes from akher rosh. So all are these that is cane sugar, date sugar or palm sugar. So these all are in any form, it is simple sugar. So sometimes patients in a tricky way, the diabetic patient asks, I am not taking sugar, I want to take jaggery powder, I want to take michri, but the answer should be no. Okay, so this is simple sugar. And even for the potassium also. Even for the potassium, nothing to give the sugar. If it is a person is non-diet, sometimes you are taking Mouri Michri jol, it is okay, but not for a long time.
Okay, sir. Thank you, ma'am. Thank you, sir.
Priyanka Chaudhary, last question.
হ্যালো ম্যাম, গুড ইভিনিং। গুড ইভিনিং স্যার। স্যার, ম্যাম আপনি বললেন যে এক্সারসাইজের সময় যেটা কর্টিসল হরমোন যখন রিলিজ হয় তখন GLUT4 আমাদের গ্লুকোজ ইনটেকটাকে বাড়ায় মাসেলের মধ্যে। তো স্ট্রেস যখন থাকে তখন কর্টিসল হরমোন রিলিজ হলে সেম জিনিস কেন করে না?
Okay, see, basically there are two major pathways. এই আমরা যখন দেখলাম যে কর্টিসল রিলিজ হলো, কর্টিসল রিলিজ হওয়ার পরে ইট উইল বাইন্ড টু দি অ্যান্ড্রোজেনিক রিসেপ্টর। ঠিক আছে, এখানে আমাদের বুঝতে হবে যে রিসেপ্টর দু রকমের হয়, একটা আলফা একটা বিটা, একটা ভালো একটা খারাপ। তো যখন স্ট্রেস হয় অ্যাট দ্যাট পয়েন্ট দিস রিসেপ্টর কর্টিসল রিসেপ্টর কিন্তু আমরা দেখবো যে যখন কারো স্ট্রেসফুল কন্ডিশনে থাকে তখনও কিন্তু তার কিন্তু সুগার লেভেল ফল করে। যখন কেউ স্ট্রেসফুল কন্ডিশনে থাকে সেই ক্ষেত্রে বেশিরভাগ সময় দেখা যায় সেও রোগা হয়ে যাচ্ছে, তারও লিপোলাইসিস হচ্ছে, right? That is even being seen, but we don't want the person to get into that phase. We want that person to enter into that phase in a healthy way. So what we are doing is we are activating the beta androgenic receptor for cortisol, right? সেটা কিভাবে করতে পারি? By the adrenaline rush or by promoting the exercise, by generating oxygen deficiency in the muscle cells. সেটা কিভাবে করব? By exercise. Is that clear, Priyanka?
Yes. Thank you.
Once again, I want to say thank you to all the students, because my first thanks goes for my students, and then my thanks for the faculty, Vijaya ma'am. So always your class is being very enriching. What Saya used to say, that when we didn't get ma'am, so we were not aware of such facts, that how to relate these things with biochemistry with our dietary practices. So day by day, I am also learning from ma'am. And we are planning for some more classes which were not in our previous batches, but in the new batches, new classes will come. And obviously, I will invite the old students who are interested to join the new classes. So few new classes we are planning with Vijaya ma'am, and she is coming to Kolkata recently, and I will have a meeting and we'll fix that. So thank you once again, ma'am, for your gracious presence, and thank you all the students. Good night, everyone.
Thank you, sir.
Thank you so much. Good night.
Thank you, ma'am.
Thank you, sir. Thank you, ma'am.
If you want to give any key message to the students of dietetics or the practicing dietitian who have joined the new course.
Yes, of course. My only message that I say repeatedly is please clear your concepts, because that is the only thing that is going to help you throughout your life. The more you learn, the better you become. Is the only thing I want
Suparna,
to
as the
say.
oldest student,
Thank you so much
Suparna,
for
any
being
key
here.
message from your side for the Cognized Nutrition MNT course? You are our oldest student and still attached. Every day we used to talk. This is something different, Vijaya.
I will be attached for lifetime because upgradation is a continuous process, and without this, we cannot stand our position.
So very simple and crisp message Suparna has given. So one thing, you are paying for the course, you are doing for the course, and that second thing, you are being attached, positively attached, emotionally attached, and you are very proactively attached with the course is another thing. So, Ami, just in a simple, in the last message I want to give, somebody is taking admission because of the placement. Obviously, the placement is the secondary. First one is the primary thing is that is upgradation of knowledge. Kaustav is there. Kaustav will also say believe, because Kaustav recently got a job in some pharmaceutical company as a dietitian nutrition advisor. So everybody will believe 30 people have got job in last 2 years. In the lockdown also many people have got job. Suparna was in a stress condition. She also got job. Getting the job is the secondary. And my recommendation when the nutrition companies are calling me, my recommendation for the jobs comes in my mind first, who are very much attached with me. So you will believe, Vijaya, যে স্টুডেন্ট আমার সাথে অ্যাটাচ নেই, আমি যা ভালো করে চিনি না তাকে, মানে থ্রু আউট দ্য কোর্স সে কখনো আনমিউটই করেনি, সো আমার কনফিডেন্সটা কি থাকবে তাকে রেকমেন্ড করার? বাট হু ইজ এভরি টাইম ভেরি মাচ প্রোঅ্যাক্টিভ, ক্লাসে কোশ্চেন করছে, হোমওয়ার্ক জমা দিচ্ছে, অ্যাক্টিভ থাকছে। কৌস্তব তো পাস আউট করে গেছে, হোয়াট ইজ দ্য নিড? কৌস্তব হ্যাজ জয়েন ফ্রম হিজ বিজি শিডিউল। সামওয়ান ইজ ট্রাভেলিং, স্টিল দে হ্যাভ joined from I can see from bus or train, they are traveling, they have joined. So this is the passion for the class. So you need to have the passion for the nutrition. Shoudadip now working as a government employee as a non-nutritionist, but only out of passion Shoudadip has joined the course. That my basic BSc and MSc is from food and nutrition, so I should judge it properly. So there are many students. One student, I forgot your name, throughout she switched on her video. She is from Bangalore. She was detached for many years from nutrition. So her husband is now supporting, and she is willing to take admission. Today we had a word in the morning, so she is willing to take admission only to brush up the knowledge. So this is all about the MNT course. So nobody will I can at least assure we will not upset anyone, and we can provide you some knowledge and some benefits. Okay, thank you so much.
Thank you so much. Thank you, ma'am.
Sir, actually, the effort you are putting, because you are not well, as I know, but still you are here throughout the class, and the effort you are putting, this is our duty to respond in a good manner to that.
Right.
Thank you.
Right.
Thank you. That's it.
Because this much effort we haven't seen in our college life, in our school. Never ever teacher put this effort.
This is very
much effort
unfortunate. We
for
start
us
the
to
class late today. We are always on time. Students may be late due to some reason, but we always try to start on time, and all our faculties are very much punctual. They join before the student.
Yes.
But today it was very unfortunate. I was after taking this medication, and I fell asleep, and it was Shushmita ma'am who have the Ananya ma'am's number, the other number. They called and informed to start the class. Otherwise, I was in a mess today. I am literally sorry for that. I apology in front of all of you. That what Suparna says. No, it is our responsibility. But still, today starting the class late. I apology, and I am sorry.
No, sir. With your মানে আপনার এত এফর্টের পরে যদি আমরা রেসপন্সিবিলিটি নিয়ে ক্লাস না করি, তাহলে সেটা আমাদের লস, এবং মানে কমপ্লিটলি আমাদের, সেটা যে আপনার এতটা এফর্ট দেওয়ার পরেও যদি আমরা মন দিয়ে পড়াশোনা না করি, তো এটা আলটিমেটলি আমাদেরই লস। মানে এখানে আপনার কিছুই করার নেই যদি কেউ মন দিয়ে পড়াশোনা না করে। তো এর থেকে বেশি এফর্ট একজন টিচারের পক্ষে দেওয়া পসিবল না, আনটিল অর আনলেস দ্য স্টুডেন্ট ইজ উইলিং টু টেক দ্য নলেজ।